Hello, this is Kim Jong-gul. Today's topic is space gaining methods. 6 space regaining methods were discussed in the previous lecture. Among these 3, expansion, 4, advancement of incisors, and 5, reproximation are methods commonly used in conventional orthodontics. On the other hand, MEAW orthodontics puts more emphasis on 1, uprighting, 2, derotation, and 6, occlusal plane change, and we are going to focus on these in today's lecture. 1.1 Uprighting is the best way to gain space, and it can be achieved by 2 methods. The first is tip-back activation, which is the distal movement of cusp tip. Another way is to use open coil springs in front of mesially inclined teeth to upright. Tip-back activation can be obtained with MEAW arch wire, and open coil springs can be used by performing strategic leveling and alignment. Strategic leveling and alignment should precede MEAW with tip-back activation for proper uprighting. Mesially inclined teeth can be initially uprighted by strategic leveling and alignment, and then further uprighted by MEAW with tip-back activation. After orthodontic diagnosis, it is necessary to think about whether to fully bond the teeth or strategically bond. Full bonding literally means bonding the entire set of teeth, while strategic bonding means selectively leaving some teeth unbonded. What kind of tooth movement occurs when the teeth are fully bonded? In this case, non-extraction treatment is preferred considering the patient aesthetics and occlusal relationship. If the teeth are fully bonded, it is likely that the lower incisors will be proclined, because the anchor value of the incisors is smaller than that of the molars. The labioversion of lower incisors lead to unaesthetic profile. Moreover, in case of a steep POP, there will not be any change in POP if the teeth are fully bonded. In the presence of a deep curve of SPI, full bonding of the lower teeth causes labioversion of the lower incisors and unaesthetic profile. In the upper arch, brackets for the upper molars have first-order rotation offset, which causes distal rotation of the mesiobuccal cusp. Therefore, full bonding of the upper arch may result in distal rotation of the molars, but rather in many cases, the upper incisors become proclined. In contrast, in strategic leveling, the teeth, just mesial to the most posterior teeth, are not bonded until the most posterior teeth are uprighted. In other words, if the second molars are the most posterior teeth, bonding of the first molars or the first molars, and the second premolars is delayed until the second molars are uprighted. So strategic leveling and alignment consists of strategic bonding and proper utilization of open coil springs. Many orthodontists attempt to upright the posterior teeth by using open coil springs as in Figure A. What is the difference between Figures A and B? The use of OCS in the first molar area causes mesial movement of the second premolar and a slight uprighting of the second molar. A key point here is whether the OCS was used with or without anterior crowding. If the anterior teeth are not aligned as in Figure A, the odds of mesial movement the second premolar is higher. On the other hand, if the anterior teeth are strategically aligned as in Figure B, the 8 or 10 anterior teeth can become a unit, which can act as an anchorage to upright the mesially inclined second molar more easily. In order to perform strategic leveling and alignment, you have to be familiar with 1. Strategic bonding. 2. Utilization of OCS. 3. Tight cinch back. And 4. Loose cinch back. There is a crowding on the upper right canine, and OCS is used in order to open a space. The first premolar will move posteriorly, and the anterior teeth will move anteriorly. The strategy here is to delay the bonding of the second premolar, so that the anterior teeth can act as an anchor to increase the likelihood of posterior movement of the first premolar. If the second premolar is bonded, there will not be enough space for the first premolar to move posteriorly. By bonding teeth strategically in accordance with treatment goal, a predictable treatment outcome can be achieved. Open coil spring is commonly used in orthodontics, and it is very useful in opening space because the compressed spring press against adjacent teeth to move. In MEAW orthodontics, the minimum archwire thickness for the use of OCS is 0.16 inch. An adequate amount of force can be generated by inserting OCS, with additional length of about 1/3 of interbracket distance. So what are the clinical applications of OCS? 1. It can be used for decrowding to make spaces for 1 or 2 teeth, and it also has an arch expansion effect. 2. It can also be used to upright mesially angulated tooth, and the mesial adjacent tooth should not be bonded in order to leave space for OCS. For example, bonding of the lower canine may be delayed in order to upright the mesially angulated first premolar, and bonding of the first molar can be delayed to upright the second molar. Before discussing about tight and loose cinch back, let's review what cinch back bend is. When the arch wire is engaged, there is a protruding end of the arch wire behind the most posterior bracket, and this part has to be bent in order to prevent patient discomfort. When using utility plier for cinch back bend, the arch wire has to be bent inward first so that the arch wire does not flare outward when bent gingivally. Otherwise, even if the arch wire end is covered with composite resin, it may fall out easily and cause intraoral ulcer. Therefore, I always make sure the cinch back bend is properly formed by checking with my finger. There are many cases of upper anterior crowding with palatal displacement of lateral incisors. If the crowding is not severe, non-extraction treatment is possible. And in this case the central incisors, canines, second premolars, and second molars are initially bonded. Oxys are inserted in the lateral incisor area, which push the central incisors forward and the canines backward. However, since the canines have higher anchorage value, there is a higher chance of the central incisors moving forward. In order to minimize this forward movement of the central incisors, the first premolars are not bonded and tight cinch back is performed. Tight cinch back can be placed by bending one end of the arch wire and then pulling the arch wire to the other side to keep the bends tightly close to the posterior of the molar tubes. By putting tight cinch back, the labioversion of central incisors is minimized because the length of the arch wire is maintained from one end to the other. In this stage, the unbonded first premolars and first molars may be slightly moved palatally. But the key here is to align the anterior teeth with minimal amount of labioversion of the central incisors. After the anterior teeth are aligned, the mesially angulated or mesially rotated terminal molar should be derotated by using OCS with loose cinch back. Loose cinch back means that there is some excess length of wire behind the tube of the terminal molar, and this is the type of cinch back commonly used. This is how I place loose cinch back. Ligate only one central incisor, do cinch back, and then ligate the other central incisor, so that some excess length of wire can slip out behind the tube of the terminal molar. If cinch back bend is placed after ligating all the teeth, the wire may become slightly deformed at the ends. Let's review strategic leveling. 1. Do not bond brackets on the teeth in front of the rearmost molar and on crowded teeth, so that OCS can be used in these areas. 2. Place a tight cinch back in case of crowding and mesial angulation. Due to tight cinch back, the labioversion of the anterior teeth is minimized, and the arch can be slightly expanded. 3. After the 8 or 10 anterior teeth are aligned, the rearmost molar can be uprighted and derotated by using OCS with loose cinch back. 4. Now the rest of the teeth can be bonded and leveled. What are the advantages of strategic bonding compared to full bonding? 1. Increase in interbracket distance reduces the amount of force exerted on teeth. 2. Efficient tooth movement. 3. Increase in non-extraction treatment. 4. Short treatment duration. Non-extraction cases can be rather simply treated by alignment of teeth and finishing while maintaining original profile. 5. Reduce possibility of orthognathic surgery in skeletal class 3 malocclusion. After the alignment of anterior teeth, slightly mesially angulated or uprighted, teeth can be moved distally by MEIW with tip-back activation. Even if there is still some remaining curve of SPE, it can easily be flattened by MEIW with tip-back activation. MEIW arch wire should basically have reverse curve due to tip-back activation. How much space can be gained from tip-back activation? 5 degrees of tip-back activation can provide 1.5 mm of space. MEIW arch wire for non-extraction case has 5 loops on each side. Tip-back activation is sequentially applied from the second loop to the 5th loop, so that the last loop has 20 degrees of tip-back activation. 20 degrees of tip-back activation corresponds to 6 mm of distal tooth movement. In an extraction case, a curve of SPE can be formed during space closure by anterior movement of the molars and posterior movement of the incisors. But it can easily be flattened by uprighting by MEIW with tip-back activation. There are cases that require considerable adjustment of second-order bend in finishing. But with MEIW, there is no need to worry about unwanted tipping movement, especially after extraction. Through strategic leveling and alignment, not only mesially angulated teeth can be uprighted, but also mesially rotated terminal molars can be derotated and turretated. Then with MEIW with tip-back activation, the teeth can be moved posteriorly and derotated further. In the treatment of class 2 malocclusion, upper molar distalization may be needed. There are mainly 2 ways for molar distalization, which are mini-screws and MEIW. Here is a comprehensive comparison of mini-screws and strategic leveling with MEAW. Treatment with mini-screws is simple, but the main disadvantages are that they require surgical procedure. Failure rate is relatively high, and the force mechanism depends on the position of mini-screws. The teeth have to be fully bonded, and the tissue reaction is likely more traumatic. The biggest problem is that the force system is mainly intrusive with mini-screws. Expected tooth movement is mainly in the maxilla and is still being studied. Mini-screws are not recommended for use on kids in growth phase, so they are mostly used in adults, and the use of mini-screws does not accompany or consider POP. On the other hand, treatment with strategic leveling is complex and requires lots of thinking. Because every patient has different types of malocclusion and amount of crowding. Therefore, strategic leveling essentially means individualized orthodontic treatment. Due to strategic bonding, the type of tissue reaction can be more physiologic. And the multidirectional force system of strategic leveling makes tooth movement more predictable in both the maxilla and mandible. Strategic leveling can be used regardless of age. And an important aspect is that mesially angulated teeth can be uprighted and steep POP be flattened. How do we treat Class II malocclusion? The mandibular dentition has to be moved forward, and the maxillary dentition has to be moved backward. The lower molars should be intruded and POP be flattened for mandibular forward movement. Lastly, the upper and lower arches have to be coordinated in transverse dimension. With mini-screws, it is difficult to intrude the lower molars and move the mandibular dentition forward. Another method to gain space is arch enlargement. Constricted dental arch can be widened by either expansion, appliance, or arch enlargement. Arch enlargement is a result of strategic leveling in MEAW. When an expansion appliance is used, the arch is expanded laterally in the posterior region, and the terminal molars are derotated slightly. However, in MEAW, the main focus is to align the anterior teeth and derotate the terminal molars, so that the entire arch can be enlarged. This is my protocol for the use of expansion appliance. I first check if there is posterior crossbite in the terminal molars, but there are not many cases with it. If there is posterior crossbite in the terminal molars in a growing patient, I use rapid expansion appliance and then perform strategic leveling. In a non-growing patient adult, mini-screw assisted rapid expansion is recommended. In many cases without posterior crossbite in the terminal molars, there is posterior crossbite in the buccal teeth. In this case, if the TPW is narrow, I use rapid expansion appliance. But if the TPW is not narrow, I use slow expansion appliance and then perform strategic leveling. If there is no posterior crossbite in both the terminal molars and the buccal teeth, but the arch is slightly narrow with this shaped, there is no need for aggressive expansion, because the arch can be expanded by arch enlargement mechanism of strategic leveling. If there is not posterior crossbite at all, and the terminal molars are mesially rotated, strategic leveling alone is sufficient. Steep POP has to be flattened, but it is not easy if the teeth are fully bonded. Through strategic leveling, the anterior teeth are aligned first, and then OCS is used to upright mesially angulated teeth. As POP is flattened, the mandible is more able to be moved forward. Class II malocclusion is generally characterized by steep POP. Steep POP can be flattened by 1. Strategic leveling. 2. MEAW with tip-back activation. 3. Short Class II elastics which upright and move the entire lower dentition forward and intrude the lower molars. In A, the molar is both mesially angulated and rotated. In B, it is upright but mesially rotated. In C, it is mesially angulated but not rotated parallel. For these three cases, space can be gained in non-extraction treatment through strategic leveling of MEAW orthodontics. However, if the molar is upright and not rotated as in D, space can be gained only by expansion. Strategic leveling and alignment can create space by correction of deep curve of SPI and correction of narrow V-shaped arch form into an ideal arch form. Treatment with MEAW orthodontics consists of strategic leveling and alignment and then finishing with MEAW. The possibility of non-extraction treatment can be increased by uprighting derotation, molar distalization, arch enlargement, and occlusal plane change in MEAW orthodontics. Non-extraction treatment Part 1 will discuss strategic leveling and alignment in depth. Let's review the space-gaining methods. 1. Uprighting. Evaluate curve of SPI and PAS. 2. Derotation. Check if the arch form is V-shaped and if the molars are mesially rotated or not. 3. Expansion. Assess posterior crossbite, TPW, and ICW. 5. Reproximation. Look for tapered triangular-shaped incisors and black triangles. 6. Occlusal plane change. Steep UOP and POP can be changed to create space. It is advisable to first consider non-extraction treatment with these space-gaining methods. Thank you for watching.